Tell me what we have got here.
We have supplies that we distribute through our syringe access program, which really involves comprehensive harm reduction. First thing here is fentanyl test strips, so people can test their drugs to see if there's any fentanyl present, which may encourage them to go slow, to use less, just to be more careful because they're higher risk to overdose. We have antibiotic cream to help keep infections away from the skin. We have cottons, which people inject through. Tourniquets. Sterile water, so that clean water is used each time to mix the drugs. Alcohol pads, which help clean the skin that prevent abscesses from forming. They help prevent people from getting bacterial endocarditis, which can affect the heart and is a quite dangerous condition for people who use drugs. We have clean tissue for when to help stop bleeding after injection. We have clean cookers to mix the drugs in. We have Chore Boy. It's used for smoking crack. And then our syringes. And then, of course, sharps containers that we give to everybody.
So there are going to be some folks out there who are going to say, why should we give folks things like this? What is your answer to that?
Well, this is really a public health intervention. We're trying to prevent the spread of disease, to prevent HIV, hepatitis C infections, and like I said, bacterial endocarditis, skin infections, things that affect the overall health of drug users. And then also, of course, naloxone, which to reverse an overdose, because people that are using together are way more likely to help each other than to have a bystander or law enforcement come by and save them. So we really want naloxone into the hands of people using together.
How effective is this? You happen to have mentioned to me that there was an incident in Scott County, Indiana, where there was a breakout of HIV. So this is not just a hypothetical thing. This is real.
Yeah, it's real. It was a large group of people that were were injecting drugs. And there was like 250 people. It was, the CDC responded to it. It was a really serious HIV outbreak. So it can happen if you're in a community and don't have access to clean equipment. People are at risk.
Are you finding from your conversations with people who use that passing out things like this is an effective way to get them into some type of help or treatment?
Yes, when people come here, we always talk to them or ask if they're ready for treatment or would like assistance in that. Everything's up to them, of course. All our services are geared to what they need. And we know from a lot of data and syringe exchanges being around for years that if people come to some sort of harm reduction syringe access service, they're 5 times more likely to enter treatment than if they didn't.
Are you finding that by doing things like this, that have you, on a local level, have you seen more folks try to get help? Have you seen more people seek out because they do feel that someone is out there trying to help them and that there is a way to get out? Or are you finding that that is not the case?
Yeah, I don't know what the overall rates are in Peoria.
But what have you
seen? Yes, we've had several of our people ask to be guided towards treatment. So we call for them or give them the phone numbers. Most of the time they have to call, but that's definitely what we talk about. I've sat and explained how medication-assisted treatment works to our clients so they can understand and know what's available to them here.